Hello, everybody. Good afternoon. My name is Eyal Shpringer, and it's a pleasure to be here in the conference and give this talk. Today, I'm going to talk about how practitioners in complementary medicine that don't have a clue about how to address subject problems, how they work together as a team, study together, and reach to all kinds of relevant conclusions that eventually help to improve patients' quality of life and their experience while they are trying to fight a very complicated medical situation. So I'm working in a private clinic, and also I'm the head of the Integrative Oncology Center at the Tel Aviv Sourasky Medical Center. And we have a pretty large service. We have like 15 practitioners from all kinds of complementary medicine fields. We have acupuncturists, and some of them are also providing manual therapies. Me and other two practitioners who are providing integrative nutrition, supplements, consultations, and also herbal medicine. We have a few body-mind interventions, a few practitioners that provide body-mind interventions, for example, mindfulness or guided imagery. And also we are trying right now to establish a group treatment sessions. Right now we see something around 400 we give something like 400 treatments a month. So it sounds very impressive, but actually when I started working 5 months ago, it was looking great, especially from the outside. And what do I mean? Okay, I'll come to that in the next slide, but first of all, let's talk about the topic of our lectures for today. We are talking today about how to address kind of a monster, which is called CIPN, chemotherapy-induced peripheral neuropathy. And it's a primary cause of compromised quality of life of cancer patients that undergo chemotherapy. This experience is like you cannot rest and you are suffering most hours of the day. Every time you are walking or holding something in your hand, maybe you want to go to a swim or take something out of the refrigerator, you can feel, not you, but the patients usually, they feel pain, numbness, tingling, and sensitivity to cold. This issue is very prevalent within cancer patients, and it also impairs the quality of life, and also people are, sometimes they have to quit their work if it's associated. For example, we had a reflexology practitioner who wanted to work with us, but she was post-chemotherapy treatment a patient, and she couldn't feel her fingertips, so she couldn't practice her profession. So it could severely affect the quality of life and the ability of subjects to work. And it's associated with several chemotherapy agents. But first of all, I want you just to remember that there is the platinum-based agents and the Taxan-based agents, that I will come to them later. So when I started working with a team, we had a very good team. They had a lot of experience. We have some practitioners that started the study like 30 or 35 years ago. We have a 71 Qigong teacher, and we have a 65 shiatsu and acupuncture practitioner, Daniel. He studied here in England. And they have a lot of knowledge-based experience, but their attitude towards the medical establishment was like, we are in a war. We come to the hospital and we are trying to protect ourselves, and also to do all kinds of alternative stuff in order to give our patients kind of alternative. Also, each practitioner used to work in his own room without integrating the methods with other colleagues, with other complementary medicine practitioners. And when I came to when I became the head of the center, I just realized that we have to to improve our walking and our learning abilities. So I have created a program and share it with my colleagues. First of all, they didn't like the idea. They said, oh, if we study evidence-based medicine, it's not so good because we will forget about our own medical systems. But I was persistent, and I took all kinds of ideas also from my training program at the MSc, training program at Northern College of Acupuncture. Also, I was influenced by the evidence-based acupuncture that I know my friend from the studies, Sandro Grassa, is part of the leading team in the evidence-based acupuncture. And also, I took a lot of papers and ideas from the website of the Society of Integrative Oncology, which is a very good a source for practitioners in my field. And I also advise you that when you want to be very good in specific field in complementary medicine, to find the main data sources and the main organizations that can support you. So first of all, I taught them how to find the relevant data sources and papers. I taught them how to understand different research designs. We were studying the hierarchy of evidence and also critical appraisal and discussions of paper. I have to state that it was very foreign and very unfamiliar knowledge for my friends, and eventually they've started to study this kind of knowledge. The second step was to define what should an integrative practitioner be oriented to. So if you can see the diagram above, you can see that there are like 5 areas that I think that an integrative practitioner have to invest his effort. First of all, he have to keep his treatment session and give the best treatment he can based on his own knowledge and experience. And this is of course, he has to do it. Secondly, when he works in a hospital, he has some personal responsibilities. Some of them are routine operations, and some of them are project development. And when you take 14 or 15 practitioners and everybody has his own project, eventually after 2 months, 3 months, you see like exponential growth. And then there's the issue which is more associated to our topic today. You have to undertake any kind of personal learning project, something that he has passion about and can improve his clinical practice. And then you have to share it. It's not enough just to study and keep all the data for yourself. You have to share it in order that not everybody will study the same topic again and again. So we can accumulate the data and we can learn much more quickly as a team instead of studying very slowly as individuals. So in order to achieve this learning project, we created a data collection template. I gave search assignments to every group member. We created PubMed and Mendeley alerts for relevant search terms. For example, in the field of neuropathy, we decided what we are going to study. We are going to look for search terms such as neuropathy, acupuncture, neuropathy and herbal medicine, neuropathy and nutrition, and et cetera, and et cetera. And also, there's not a lot of data regarding the treatment, the alternative or the complementary treatment of chemotherapy-induced peripheral neuropathy. So we were looking at the diabetes-related peripheral neuropathy in order to get some kind of ideas that we could implement with our own patients after certain modifications. The third step was to categorize the evidence-based intervention. It's also important for us to know what is the strength of the evidence. And also another important reason to do it is because if we're going to be asked by any kind of medical practitioner like doctor or nurse, why are we doing what we are doing? What is the rationale for our practice? We can show them that we have like a high quality, for example, RCT that supports, for example, I will just give you an example from another topic, like there is a good research that about American ginseng, for example, for chemotherapy-induced fatigue with breast cancer patient. And if I provide the evidence-based source, so my intervention will be much more easily accepted. And the fourth stage, and very important, is to share the knowledge. Here you can see the initial lecture of Dganit, one of my close friends and practitioners. And she was here talking about the Western point of view, the conventional point of view of the peripheral neuropathy. And what we are trying to do in this stage, we're trying to relate the research-based data to complementary medical system framework. I will demonstrate it to you, this issue in a minute. And we share this knowledge through lectures, through discussion, like we're talking between ourselves, like we're doing Zoom sessions, we are writing to each other and try to build our knowledge. We are trying to think about all kinds of alternative or different search strategies. And also we are applying the treatment strategies that we are thinking about and try to get initial feedback from our patients. And we are sharing the case studies between ourselves in order to get the understanding where things are going to and what seems like the best treatment options that we can provide following all the learning process. So the fifth step is to design the initial protocol. And we divided, for example, in the case of the neuropathy, we divided to how we provide the treatment before the chemotherapy in order to prevent, what we are doing during the chemotherapy and what we are doing after the chemotherapy. And every single practitioner had to provide his input regarding his own treatment method. And then we summarize everything and we practice and we get the feedback from the patient and redesign the protocol and again until we get the best solution we can provide to our patients. So I'm really pleased to share with you one of the ideas that we are using in our clinic in order to address the chemotherapy-induced peripheral neuropathy, which is related to different agents, different medications. So on the left, we have the carboplatin related chemotherapy peripheral neuropathy, and on the right, we have the Taxol agent. And as you can see on the left, the carboplatin peripheral neuropathy usually is more oriented at damaging the root ganglion, which is very close to the spinal cord. And the Taxol agent, usually they damage the whole length of the nerve, and especially they have a very tremendous effect on the axon. So we have here like damage which is more central and different kind of damage which is more peripheral. Usually patients are feeling the same, but for us as Chinese medicine and complementary medicine practitioners, it's very important to see the pattern, because as Chinese medicine practitioners, our minds are trained to look after patterns. So the patterns that we identify that underlie the treatment with these two medications is that the platinum is actually originally is based on kind of metal. Platinum is actually metal. And when you say to a Chinese medicine practitioner that something is associated with metal, he immediately thinks about contracting and O2 and something which is more cold and condensed. So the platinum is more associated with central damage. It has a deeper effect and is related to the metal element. And the Taxol is originally is derived from the Taxus species, which is kind of herb, and then we think about the wood element, something which is more dispersing, something which is the chi is going more to the peripheral aspects of the body, more the superficial aspects of the body. And then while remembering the translation from the conventional point of view to the complementary point of view, we started to design our treatment approach. For example, if we are looking at the Chinese medicine in the platinum and the Texan related peripheral neuropathy, you can see that the platinum is more related to treatment which are oriented at the Dumai and the Jiaji points. And also we were more looking at metal and water patterns. Of course, we have to do a personal diagnosis and check the pulse and the tongues and all the other signs, but we are more oriented to the metal-related treatment. And also the nutrition, we're trying to find the nutrients which are more nourishing and supporting all related gene tissue, more nourishing and supporting nerve tissue foods. And also about the body-mind therapies, the meditation, the orientation of the conversation with the therapist is more about central issues like me, myself, the central alignment of the body. And when we're talking about Texan, the orientation of the treatment is first of all, we are suspecting more like that we have to treat the periphery of the body, like treating all kinds of imbalance between Wei Qi and Yin Qi, activating all kinds of peripheral meridians like the Chong Sun Lo and the tendomuscular meridians. And also about nutrition, we are thinking about foods that support peripheral circulation, something like more like a ginger or a kuzu, or all kinds of practices like body-mind practices, which are more about sway show, which is moving the hands from right and left in order to increase the blood flow to the periphery of the body. So this is kind of rationale that we have in mind while we're approaching the specific patient and trying to diagnose his specific status. So if I will summarize the process that we were going through. So first of all, and I have to say that this process, you can also implement it in your own practice in any case that you want to give better solution for diseases or symptoms that right now you are not sure how to provide a good answer. So first of all, you have to check, you have to go through an evidence-based medicine training program. If you are students of the Northern College of Acupuncture, so you are already lucky, and this issue is already covered. And then you have to do your homework. You have to map the field of your interest, and also you have to categorize existing efficient interventions. Then you have to find some kind of a good group, friends, maybe find a mentor to communicate the knowledge and get some feedback and see whether you can even improve it a little bit more. And then you have to go into protocol design and implement the protocol and see what comes up and try to improve it and go back to your group and slowly to condense and structure the treatment protocol that is unique for you, and then you are slowly can become better in what you're doing and maybe also becoming an expert. So what about the outcomes? The outcomes for now, for what we did is that, first of all, it's for the patients. Our patients are already reporting positive outcomes. Of course, we might be biased because we are looking for these kinds of outcomes. We are experiencing less CIPN-related symptoms with our patients. The improvements compared to the past last for longer duration. And also there's a group of patients that are going through chemotherapy. They are getting our treatments while they're getting their chemotherapy or a little before getting the chemotherapy. And sometimes, and we see more and more patients that don't get these symptoms at all or getting them very, very lightly. The team also benefited from walking in the periphery of knowledge because when you are walking in the periphery, you die sorry, it's a little harsh word, but you perish or you get better, you get stronger. And our team got stronger through working in this periphery of knowledge. The protocol design is actually still in progress, but the practitioners are more confident with treating these symptoms. They are more confident with the teamwork. They have discovered that there is a team that you can work with and study, even though they were working with this team for the preceding 10 years already. They're getting more referrals from the oncology division personnel because they show that they have more confidence and they know what they are talking from the Western point of view, but also from their own personal and point of view. And we are also starting to design a research proposal that will take place after I will finish, hopefully, my dissertation on January, and then we have more time and energy to go and conduct this research with colon cancer patients that get chemotherapy. So my conclusion is that all the materials that you need are at hand. You can find the people, the good friends that you can take with you to the journey. You can find the sources, the databases, and then you just have to systematically start to study and collect the data and share the data and experience and practice the data. And then you will start to see changes in your confidence and in your patients. So I'm very thankful for you for listening for my talk. And if you have any questions, you can contact me through the email, and also I'm here for any questions. Thank you very much.